Thanks for stopping by my channel. Today I want to continue on my mental health series. In this episode I will go through therapies for bipolar disorder. Here is an overview of some self-help tips. Tell someone. Find ways to lower your stress levels. Understand your warning signs. Tell your doctor when you feel something is wrong. Avoid situations potentially triggering mania. Make a plan about dealing with early signs of relapse. Here we have more self-help tips. Good eating habits. Stop smoking. Avoid drugs and heavy drinking. Don't have too much caffeine. Have a stable sleeping pattern. Keep taking your medication. Join a support group. Therapies commonly used is cognitive behavioral therapy, interpersonal therapy, behavioral couples therapy, family-focused therapy, and some of the most common medicines used is antipsychotics, mood stabilizers, antidepressants, anti-anxiety medication. Here we have a model over the mood swings. As you can see, the mood can get elevated from normal to hypomania and to mania, and it can get lowered to mild depression and severe depression. When you use some kind of mood stabilizer, you tend to cut off the biggest valleys and the biggest peaks, so you hinder the patients from getting up to full-blown mania or to a severe depression, and you keep them in the mid-range so they don't get as severe symptoms. As for bipolar disorder, some type of mood stabilizer is commonly used. The most common is lithium, and you can also use lamotrigine. You use the mood stabilizers to prevent the depression and mania from becoming too severe. When lithium is used, it's very important to monitor the thyroid levels and the kidney function regularly. When somebody is going from a normal state up to hypomanic state, you can use antipsychotics to prevent the mania from getting too severe. Also, when someone has full-blown mania, you can use antipsychotics to get them more stable and prevent the mania from getting into psychosis. It's always a risk if you don't sleep and the brain is running full speed, you can get psychotic. Lamotrigine is originally an anti-epileptic, and it also can be used to treat the manic episode. On top of the mood stabilizer, some antidepressants can be used. It's important to use them in conjunction with the mood stabilizer, because if you don't have that, some antidepressants can provoke a manic episode. Oftentimes also anti-anxiety medication can be prescribed. These are some of the most common medicines when it comes to bipolar disorder. People are different and respond differently to different medications, so your doctor might have to try to prescribe several different combinations before you find what works best for you. When someone with bipolar disorder is stable, there are several different types of psychotherapies. For example, CBT or cognitive behavioral therapy. In that you focus on feelings and thoughts and how they impact behaviors. We also have family-focused therapy. There you focus on communication and problem-solving skills. And there is interpersonal therapy. There you focus on relationships with other people. We also have behavioral couples therapy. There you focus on resolving emotional problems between partners. When someone with bipolar disorder symptoms have symptoms of schizophrenia as well, and psychosis, it is called schizoaffective disorder. Next video I will make will be on schizophrenia and go into more about psychosis. When I make videos on these heavy topics, I will always put links to suicide prevention hotlines in different countries in the description. Thanks again for watching. See you next time. Bye.